Welcome to the podcast for Healing Neurology, where we talk about everything that can help heal your neurology, which is really everything, from food, lifestyle, and medicine to nature, culture, and politics. There's no topic too big or too small. I'm Jillian Ehrlich, family nurse practitioner, certified in Ayurveda and functional medicine. And today we have with us Dr. Carley Squires. She is a board-certified naturopathic doctor who received her naturopathic doctorate and her Master's of Science in Chinese Medicine and Acupuncture from Bastyr University. She also holds additional certifications from the American Academy of Regenerative Medicine, the American Osteopathic Association of Prolotherapy and Regenerative Medicine, PureXL, a regenerative medicine biotech company specializing in advancements of autologous stem cells and platelet-rich plasma, and advanced training in musculoskeletal ultrasound. She has been a part of the Center for Healing Neurology since nearly its inception, and she also runs her own private practice in Seattle, which is Balanced Medicine Clinic. So we are going to talk about regenerative medicine today, especially the osteopathic parts. So Dr. Squires, welcome.
Thank you so much for having me.
I'm always amazed at what you know and what you do with the musculoskeletal system. That is what I'm really excited to talk about. And so to get started, let's just talk about what is regenerative medicine.
Yeah, so regenerative medicine is used to help the body heal and relieve pain. So the body has these constant natural regenerative processes, and when tissues break down in the body, our regenerative processes work on healing them through appropriate inflammatory and immune processes. However, when we experience injury, either from a high force such as a trauma, from something like a car accident or a sports injury, or just our chronic wear and tear from a repetitive everyday movement, our body's regenerative processes may not be able to produce an efficient inflammatory response to heal the injury.
This is really interesting because so what we're talking about is really this flip sides of the coin for inflammation and regeneration. So there's ways in which we get inflamed, and inflammation is such a hot topic right now with cytokine storms and COVID-19 and the inflammation that comes not only from this virus but also from metabolic syndrome and kind of the chronic inflammation that we have in our life. And then we have these particular assaults on top of that, like a musculoskeletal injury, like you sprained an ankle, you fall, you have a back pain, all of these components. And so can you talk to us a little bit about like the inflammation that we need for remodeling? What role does inflammation play?
Yeah, that's a great question. So when we think about regenerative medicine, we should think about there's a scale. So there's a scale that our body has an appropriate immune inflammatory response. So not all inflammation is bad. Inflammation is good. Acute inflammation signals our body to heal an area. So it sends all of these messengers and these growth factors and these immune cells to an area to heal. But when that process is ongoing, sometimes the body gets distracted. So it might have inflammation in the digestive tract, or it's dealing with heavy metal toxicity. So what happens is our body has a sprained ankle. It can only do so much, but it gets distracted by all these other things, and we can't amount an appropriate immune response to heal that area. So then we have this chronic low-grade inflammation, and what that chronic low-grade inflammation does, it almost chews up our tissues. It's this chronic ongoing process. So that's how we get degeneration of tissues and osteoarthritis. It's eating up all of our tissue and our cartilage. So what we need to do is to heal all of that whole body inflammation. We need to make sure we're taking care of all of those factors in our body so that our body can have an appropriate immune response, an acute, robust immune inflammatory response to heal the area.
A lot of the treatments that we are going to talk about today, especially something like stem cells or ozone or hyperbaric oxygen, a lot of that is really whole body. So that's the component that we're looking at. Is that what you're saying? We're trying to take down the whole level so that we can focus on specific things that hurt?
Yes, exactly. It's like anything. When we are multitasking, how much focus can we have on one thing?
Nothing.
So if we have 5 things going on, we're only giving attention, a little bit of attention. But if we truly want to heal an injury, we want to heal our body, we have to really focus in on one area. We have to say, let's heal this. Let's do it appropriately with all our attention and all our forces. And if we can do that, then we can move on to more optimizing our health.
And this is perfect to come out of a naturopathic perspective because that really is the body heals itself and really starts with a baseline foundation in diet, lifestyle, mental health. Is that right?
That's right. I think that's why I was so interested in regenerative medicine. One of the main principles of naturopathic medicine is the vis medicatrix natura, which is Latin for the healing power of nature, or the innate ability of the body to heal, which is what we're doing with regenerative medicine. Like I said, we're tipping that scale. If on one end we have the regenerative processes to heal, and on the other hand we have degeneration, which from an injury, the scale gets tipped to more degeneration. So what do we need to do? We need to tip the scale back to more regeneration so we can heal.
When you evaluate a patient in clinic, how do you start their evaluation?
So I think it should be a whole body evaluation. It should never just be focused in on just our osteoarthritis, for instance. Of course, we are going to treat that, but we need to ask all the questions as far as how's your digestion, how's your sleep, how's your diet, how are your emotional and psychological stressors, how are your hormones, how are you, we need to balance those out. So all of these things have a piece. So it would be a whole body assessment to see where in the body do we need to address to eliminate that whole body inflammation so we can have a cellular efficiency in our body, an efficient way to heal.
A lot of generalists, family nurse practitioners, naturopaths, a lot of generalists don't end up focusing so much on musculoskeletal. So tell us a little bit about your interest in the MSK system.
Yeah, going through school, I guess I was always an athlete, so I was always interested in more sports medicine, and I had a fantastic mentor in my schooling that was a chiropractor, and so he taught me a lot of osteopathic manipulations and chiropractic, and so just this idea of how important our overall structure is to our function, and vice versa, how important our function is to our structure. So he really instilled with me that we have to have proper alignment and proper structure to also have proper function. So I was just always fascinated by that and kind of went down that line of being able to help people in pain. It just seemed like those were the tools that I was most efficient at.
How did you learn so much about individual joints? I'm so curious, like shoulders or knees.
Yeah, so, after school I did a lot of training just all over the country, visiting everyone from sports medicine to orthopedic surgeons. So in their offices, trying to learn as much as I can. I had another great mentor that was a radiologist, and so I've spent hundreds of hours with him looking at images of musculoskeletal joints so that I could most efficiently try to treat people to really understand what is the root cause of their musculoskeletal condition, whether that is a tear in the rotator cuff or just osteoarthritis of the knee, and what also is affecting that joint. So if you have osteoarthritis of the knee, you probably also have hypermobility of the ligaments surrounding your knee, and how can we truly treat all of that? And so I just tried to study as much as I could to make sure I was treating people effectively and efficiently.
Well, you're doing assessments, and you do really full assessments of joints. Like if somebody comes to you with a particular joint pain, are you using imaging? Are you using ultrasound? How are you evaluating that joint?
Yeah, I think that all exams should have a thorough history, a good physical exam with orthopedic examination and test. And then also I do ultrasound in office. If it's something that ultrasound wouldn't be able to see well, then I would refer out for either X-ray, plain films, or MRI.
Let's talk about the treatments that we have for joints, because we do some pretty unique treatments. You do some pretty unique treatments here. What are those?
Yeah, so I think that common misunderstandings are what the different injection therapies are for different treatments and when they are appropriate. So originally there was prolotherapy, which is named after just proliferation. You're trying to create an inflammatory response. So prolotherapy is excellent when there's hypermobility of the joint. And hypermobility can happen when someone has a strain or sprain. Ligaments can get stretched out, and when they don't appropriately heal, like we talked about, then they can become hypermobile. And so there's chronic movement, and what that chronic movement does is create that low-grade inflammation we talked about that can start chewing up the tissue, chewing up the cartilage, and create osteoarthritis down the road.
A couple questions about hypermobility, because we talk about that in other podcasts, like with Linda Bluestein. We have a lot of patients in our practice with hypermobility. Do you find that there's kind of the genetic predisposition, and then it's the life that lead to chronic hypermobility in the joints, so that loosens up the joints?
Absolutely. So definitely there's different factors that can happen. Either it can be post-injury. I see it commonly after someone has a whiplash in a car accident. Those ligaments, you think of the force of a whiplash. So all of those ligaments around your vertebra in your neck will get stretched out. And so if they don't appropriate heal, then you'll have chronic hypermobility. And people will tell you years later they still have neck pain after a whiplash. And that's usually because those ligaments got stretched out and never appropriately healed. But there are genetic predispositions to hypermobility, and so those are the people that are chronically injuring multiple joints in their body, and that just has to do with the fact that genetically they're not making as many of the precursors for strong connective tissue, essentially.
Let's say a listener out there has had whiplash, and is prolotherapy appropriate initially? Like, how far down the road can it be helpful? What's the timing look like for that?
Yeah, it is effective. Usually, you'd wait a couple of weeks. You'd want to make sure you're in good alignment, and then you're actually working on decreasing as much inflammation from that trauma as possible with appropriate foundations of health, diet and sleep, but also, any kind of nutraceuticals that you might need to decrease inflammation. And then if it's not healing appropriately after that, you could do the injection therapy. But I've done injection therapies years later for chronic pain, post-whiplash, when people are like, I've had neck pain for, 5-10 years post, and they still get benefit from it.
If you have even, let's say, a whiplash injury that's got this chronic and low-grade inflammation, why does adding more inflammation help?
Yeah, that's a good question that, is hard to wrap your head around, but it's almost like you could think of when we have a cold, and if you've ever had a cold that just wouldn't go away, your immune system isn't mounting an appropriate immune response to take care of the virus, to take care of what's causing the cold. And when you can mount enough of an immune response, then you heal that and it leaves, right? And you no longer have a cold. Same with inflammation. If you have this low-grade inflammation, but the body doesn't have a robust enough immune system inflammatory response to heal that area, then it will just go on being chronic low grade. So what regenerative medicine does is it stimulates a robust immune response, inflammatory response, to heal the area fully and efficiently.
And what does a course look like? Like, how many treatments does a person get?
Yeah, so often with any type of injection therapy for regenerative medicine, you do need more than one. Prolotherapy, I usually would do a round every 2 to 3 weeks, and you would need several rounds, but everyone is different. So you can't say, okay, everybody's going to need 3 rounds. So depending on who you are as a person, other things you're doing, the severity of the condition, your age, a lot of factors play into how many you will need, but most people do need more than one.
What's the outside do people sometimes need 5, 10, 20, 50?
For prolotherapy, I would say, it's anywhere 3 to 6 treatments usually gets people to where they need to be. The next step up, if, is kind of where we're going, is talking about platelet-rich plasma.
Yep.
And so that's PRP. And so platelet-rich plasma is kind of the next step up from prolotherapy. So it's a similar idea. You're creating this immune inflammatory response to heal. The difference is when we take our platelets have a number of growth factors and other immune cells in them. You think about when you get a cut on your arm, what's healing that is platelets in your blood supply. So what we're doing is we're taking out platelets from your blood and we're injecting them into an area of injury. So in prolotherapy, your body has to call all of those immune cells and those growth factors to the area. In PRP, you're directly putting them in. So it's a little more potent. It's great when instead of just hypermobility, you actually have tearing of ligaments or tendons, you have moderate arthritis. That's when platelet-rich plasma can be very beneficial.
And with arthritis, you're talking about osteo versus rheumatoid, correct?
Yes, I am talking about osteoarthritis. If we were talking about rheumatoid arthritis, we'd probably talk a little bit more about the stem cells, which we will.
We actually didn't mention with prolotherapy what is being injected.
Yeah, so prolotherapy is you're trying to create an irritant. So it's a dextrose, which is sugar water, used in IVs, extremely safe. And you usually put an anesthetic in there, like lidocaine or procaine, and some sterile water. You're essentially just creating an immune response with an irritant, but really benign substances that don't have any side effects.
So let's talk a little bit more about PRP. What does that course look like?
So that I wait a little bit longer. So the whole inflammatory cascade is usually 4 to 6 weeks. So a lot of people will do prolotherapy monthly. Oftentimes I do see around 3 rounds average that a lot of people respond well, maybe less, maybe more, depending. And so it would be an injection every 4 weeks for maybe 3 or 4 months.
Can this be years after again?
This can be years after, and of course what's great about the platelet-rich plasma is it's great for treating that moderate arthritis. And so like we talked about, if we have a chronic injury that isn't healing, oftentimes that will lead to arthritis because all of those inflammatory molecules are kind of chewing up the area and creating this degeneration. So you can do these injections years later and still get good results. If you have a tear of something like a rotator cuff, usually you'll be in more pain and do those earlier. If you're doing it years later, you're most likely just treating the arthritis.
It's interesting. What you're mentioning here is finding this balance between anabolic activity, metabolic activity, and catabolic metabolic activity. Anabolic activity being the building up. So at all points, one of the things we have to remember is that, and I don't actually know if this is true, but it's like every 7 years, every cell in our body regenerates. I know the gut lining turns over in 3 weeks, so those are, those more mucosal cells are more quickly turn over. But the idea is that we have to constantly make new cells, and so we are making new cells as we go. So when you have a whiplash injury, let's say 7 years later, the cells that are in pain then are not actually the same cells necessarily that were injured, but those cells that were injured essentially trained those new cells coming up how to be, and it essentially trained them to continue that inflammation, to persist that inflammation. So we develop these metabolic patterns. What we know is that we need to be rebuilding our cells all the time, and we need to be breaking down the old cells. So that's that teeter-totter balance. But if we tend more towards inflammation, then we stay in a catabolic state. And that can happen with arthritis, with something moving, as you're talking about so brilliantly, from an injury to an arthritis. That can happen with osteoporosis. That's really the reason. If we all just lost all of our bone as we age, we would not have made it this far, evolutionarily speaking. So it's really the fact that we have so many pollutive influences that we're set into this catabolic state, and so our bones leach out and don't remodel as they're supposed to. And it's the same thing with cognition, right? So brain cells, and that's part of what Bredesen protocol and these Alzheimer protocols talk about, is that we're in the state of catabolism, and so we are not building the cells that need to do the connecting, so we decline over time. So this is a really nice way to think about, if you've got this lingering inflammation, you're going to be set into this catabolic trajectory, and so we want to really rebuild it with the plasma-rich proteins.
Yeah, absolutely. And as we'll talk about really soon is how stem cells really, it is about the environment you put them into, and how they're actually medicinal signaling cells is a better name for them, because they're really just signaling the body to repair. So what you're talking about when there's this chronic low-grade inflammation and the body is getting these signals to constantly do the same thing, even though they're different cells, that's exactly what's happening. We have to create different signals. And so what regenerative medicine does is it flips the signal for your body. It retrains the signal to more healing than degeneration. Because, we're taking it from your own body, right? So these platelets and growth factors are in our body. We all have these stem cells in our body. So we wouldn't be alive if we didn't have these stem cells circulating in our body. So what these therapies do is we're just taking a concentrated dose. We're kind of taking them out of storage, and we're putting them where we want to for healing. We're changing the signal.
Tell us a little bit more about stem cells. Well, actually, one last thing with PRP. So the process of PRP essentially is pulling out... You're pulling out blood?
Yeah, it's a regular blood draw. So it would be like anytime you've gone to the lab to get a blood draw, you are just getting a blood draw, and then we're spinning it down, and we're getting the platelets and some plasma and some red blood cells and white blood cells. They're all part of that healing process. And we're processing that and then injecting it back into you. So it's your own tissue. So there's no fear of, having an immune rejection to it, or, there's always a chance of infection anytime, you're injecting anything or opening the skin. But other than that, it's a really safe treatment. There is different levels of stem cells, and the ones we talk about with regenerative medicine are adult mesenchymal stem cells most often. And so they just have the ability to differentiate and proliferate into certain tissues. And so mesenchymal stem cells have the ability to differentiate into bone and cartilage, ligaments, tendons. And so that's what a stem cell is. It's just kind of more of a naive cell that can go and get turned into something that we need to regenerate a tissue, for instance.
As you're talking, it's literally like the stem of a plant coming out of the ground that can become a stem, a leaf, a flower.
Yeah, and that's actually a great analogy is PRP is like fertilizer, and stem cells are the seed. So that's a good way to think about the difference when we're thinking of treatments of PRP and stem cells. So we literally can grow this tissue, that we need. This is your own tissue, your adult stem cells. So they are already a level of differentiated. So these specific mesenchymal and hematopoietic stem cells, they can grow into things like cartilage, tendon, bone, some nerve tissue, but they can't necessarily, they are going to have tumorigenic effects for these.
What's the process of doing stem cells? What does that look like?
So there's different sources of stem cells. Again, I'm talking about autologous from your own body. You get them from bone marrow, and adipose are your fat tissue. There are some stem cells, like I said, just circulating in our body. So there are some in platelets and blood, but for the most part, we're harvesting them when you get a treatment from bone marrow and adipose or fat tissue. So that would look like a mini liposuction procedure. Are getting bone marrow from most likely your hip bone.
I know some of the answers to these questions. I'm asking them because I'm asking what you might be thinking at home.
Yeah.
So once you pull them out, what do you do with them?
Yeah, so there's different processes you can do. Bone marrow is similar to the platelet-rich plasma where you're just centrifuging it, spinning it down, processing it. There's different processes for adipose tissue, whether in orthopedics, we just use it as a scaffold. If we're talking about stromal vascular fracture, which is the type of stem cells that you would put into your body intravenously, and stromal vascular fracture just means that you have all of these goodies that we break down your fat with an enzyme and then pull out the mesenchymal stem cells, progenitor cells, which just help proliferate, and other immune cells. And we put those in intravenously. So those are broken down with collagenase or an enzyme.
Here in our clinic, we incubate them, we cook them down, so we kind of have them multiply. And
yeah, it's a whole process to kind of break them down from the original tissue, because if you think about these stem cells are being stored in your bone marrow and fat tissue, and so we are just creating a way to get them out, and so that we can get them back into your body in the concentrated dose that we want to.
And so we can give them back via an IV or as a local injection. So when would you choose to do IV, or when would you choose to do local?
Yeah, so the local injections, which is when you would use bone marrow or you would use the fat as a scaffold, those are for any kind of orthopedic condition. So really severe arthritis is great for stem cells versus moderate arthritis. Platelet-rich plasma would be better, are sufficient. And other things, how severe the tear is, really you look at the person and you say, what's the severity of the injury, the chronicity, how long it's been going on, what's the age of the person, because as we age, our healing abilities do break down a little bit, though we're finding better ways to kind of treat those senescent cells, which I'm sure we'll talk about at another podcast at some point, the amazing ability and understanding of these senescent cells. But so all of those age, severity, chronicity will go into determining if orthopedically you would use platelet-rich plasma or stem cells.
Does it have anything to do with weight bearing or the size of the joint? So I'm just thinking about thumbs, or the base of the thumb is such a common place for arthritis versus like a knee, which is going to be carrying all your weight.
No, that doesn't go into my decision making. It would be, more of the age of the patient, the severity, how long it had been going on, maybe other things you've been treating. If you're doing it here at the Center for Healing Neurology and you're using stromal vascular fracture, so you could do intravenous as well, then you would be thinking, is there other sources of inflammation or illness that we're also trying to help the body heal?
What would be some of your targets for IV stem cell therapy?
Yeah, so the way I would think about IV stem cell therapy is I would never think of it as treating one particular disease. I don't think we should think of it as a therapy for a disease. We should think about it as a therapeutic to help the body heal. So if you have a chronic illness or an autoimmune disease, those regenerative processes, right, are being outweighed by degeneration of your tissue. So really what we want to do, and what stem cells are so great at, is creating an appropriate immune response. So think about it more as you're optimizing your health, you are optimizing your immune system, and you're decreasing overall inflammation to heal you as a person, to optimize your health, but not necessarily treat a condition.
So stem cells are upstream cells. How long does it take for you to see a benefit from these different therapies?
Yeah, everyone will have a different healing response. Oftentimes with any of the injection therapies, you may have an initial exacerbation because we are creating a more inflammatory immune response. So there is actually an initial increase in pain and inflammation. And then usually by 2 weeks, we start to really see that they are helping people. And then, that's 4 to 6 weeks, we see good results. When you're talking about stem cells, especially using them intravenously in that whole optimizing wellness and health, stem cells can continue to remodel things for months, maybe 8 to 10 months later, you still might be seeing benefits from them. So that's a good thing to keep in mind. It's not necessarily an overnight treatment, but it does take some time. We're really just supporting your body and healing. And everybody has a different ability to heal. And there are, different things we'll talk about that optimize that healing response that you can do to your body. Decreasing whole body inflammation is another way that you'll get the most efficient results from these therapies.
How do the stem cells know where to go?
Like we said, a good thing to remember is that they're called mesenchymal stem cells, but it's important to remember that there really should be medicinal signaling cells, because what they're doing is they're signaling a healing environment. So research is showing that it's not how many stem cells there are, but it's really the environment they create that makes the difference.
What do they change in the environment?
So they actually will signal your messengers. So you have these protein messengers, these cytokines that we heard, like you said, with cytokine storm and those things. There's really pro-inflammatory ones, and then there's more anti-inflammatory ones. And they can actually shift that environment to more pro-inflammatory, to more anti-inflammatory, to allow for healing. And they have a homing mechanism. They have this, that whole innate ability to heal, where they do really migrate to the area of most injury. And I don't know how they do that. It just has been shown that they do have this incredibility to home to the area of most inflammation. It's probably that they are following that signal from the body. So the signal is amplifying these pro-inflammatory signals, and that attracts those stem cells to the area of injury. And that's how they kind of find their way.
What this is saying is that you don't have to worry about doing anything specific to get them to go to the place where they need to go.
No, your body is screaming out signals, and those stem cells are listening and they are finding it. It's just how the body knows where an injury is. How, like we said, when you have a cut, how do the platelets know to go there to heal that area? There is a signal from that area that the body, the chemoattractance is what it's called, chemotaxis, that signals those immune cells to the area of injury. If we can just trust our bodies to heal, they really do know what to do.
I think one of the challenges, and we've talked about this in our podcast before, is I think for many of us, our bodies have not been safe places to be in. We've experienced trauma, we've experienced hardship, grief, loss, longing, loneliness, and so often we don't stay in our bodies, and so we close off those signals. So part of the healing really is listening again, and it can be helpful to have these stem cells do some of that listening.
Yeah, absolutely. I think so often in our world, we give our power away when it comes to healing. We want someone else to fix us. We're told that, we don't have any power to heal ourselves. And if we can really start to go into that and trust that ability, that our body really does have an innate ability to heal. And I think you're right on creating that safe place. So much of that trauma, and there is so much work nowadays of working with that safe place so that our nervous system can calm down and flip more into that healing, that rest and digest, rather than the chronic fight or flight that we're in. And so I think those types of therapies are so important to any kind of medicine we're doing.
And that really is what we highlight, just to toot our own horn here at the Center for Healing Neurology, is really the ancient techniques of disciplining the mind and resolving unprocessed emotion, as well as these modern technologies of stem cells and PRP and prolotherapy.
And I always say that there is a time and place for all medicine, so I think we really need to be open-minded to all different types of medicine, whether that's conventional pharmaceutical, like with orthopedics, absolutely there's a time for surgery, and I tell people when that is appropriate, because there are times when surgery is the most appropriate thing, but there's also times when regenerative medicine is the most appropriate thing, and really trusting that age-old medicine with newer technologies, that is the best way. I think we can kind of support our patients.
Let's talk about some of the adjunctive therapies and kind of targets of those adjunctive therapies that help with prolotherapy, PRP, and stem cells. That's kind of our focus today, but let's talk about some of those things that surround and support that healing.
Yeah, so I like to think about if I'm treating someone, if we could focus more on this musculoskeletal, the MSK, how do you heal an area? Well, you have to improve blood supply because within that blood supply, all of these good nutrients, but most importantly, oxygen. So you support oxygenation of the tissues. You have to improve mitochondrial function so you have energy to heal. And then you want to support the immune system like we've talked about, so you have that appropriate immune response. Decrease inflammation. For most of us, we just have too much inflammation going on, even though inflammation's not bad. It's just too much and too long is bad. All of our therapies, that's kind of the basis that I think about. How do I improve people's blood flow? How do I improve their oxygen? How do I support their mitochondria, immune system, and decrease their whole body inflammation? So those are the goals, and we can talk about those. And I think that I never want to overlook foundations of health. And so everybody wants to jump to, well, what do I take? And really, if there's anything I could tell people, it would be prioritize your sleep. We know how important sleep is. Not only sleep stimulates appropriate inflammation. So if you have any sleep deprivation whatsoever, you have an increase in those cytokines, those messengers that are pro-inflammatory, the same ones we're trying to decrease in regenerative medicine. So it's really important to get adequate sleep. At the same time, our bodies can only heal when we're sleeping. That's when we have the most growth factors circulating and stem cells circulating. So sleep is important. And diet, of course, if you're eating 3-4 times a day, inflammatory foods, I mean, that's the number one source that you could decrease. And then movement, exercise is so important. Not endurance, you don't have to go out and run marathons, just, 20, 30 minutes, a few days a week, really does not only have cardiovascular benefits that we know of, but it really does shift that inflammatory milieu, like the stem cell environment that we want.
Yeah. I learned from my mentor, Keisha Ewers, 3 sweaty t-shirts a week, because the beauty of that is that you can always work right along your edge. So when I've been in shape and I've spent a lot of time outside, I might need more time. But when I'm really out of shape, a 10-minute run in my neighborhood and I'm sweating.
Yeah, I think everyone gets turned off like, oh, if I'm not like running 60 minutes a day, I'm not, what's the point? Yeah. And no, actually, more and more research is focusing on those high intensity. It actually has just as much, if not more, benefits than any kind of endurance training. And then you have less oxidative stress in your body, which creates that inflammation that we're talking about. So actually, I think, HIIT workouts are the way to go, is what research is telling us more and more of.
Tell us about some of the adjunctive therapies that you use alongside to reduce that whole body inflammation as well as to target joints.
First, we want to focus on those foundations of health and removing any of those obstacles to cure. So like we talked about, just to reiterate, we want people looking at what environmental toxins do we have, how can we support proper detoxification. The intestinal digestive tract permeability we know is so important. Social, psychological stressors, especially that feeling safe that we talked about. Chronic infections are another one that, don't get addressed often enough. So have someone looking at those. Hormonal imbalances, whether that's your stress, your thyroid, your sex hormones, all of that makes a big difference in inflammation. And then, of course, there's genetic predispositions. But if you can do everything else, support all those other things, then you're going to, be on a good pathway. And then, so as far as adjunct, there's ozone therapy is great, which we utilize here. So ozone, it's O3, but what it does is it gets broken down and it kind of absorbs all of these free radicals, which create oxidative stress in your body. Ozone also works by improving your oxygen utilization in localized areas of damaged tissue. So I often inject it with any kind of platelet-rich plasma or stem cells or prolotherapy because, one, it's shown to switch that whole messaging system of the cytokines to more healing and anti-inflammatory. And also, like we talked about, we need oxygen, we need energy to heal. And so it really supports that oxygen and energy to heal.
And ozone, tell us a little bit about what that looks like.
So ozone is a gas, and you either would inject that right in to the joint to do those things we just talked about right after any kind of PRP or prolo or stem cell. You can also do oxygen intravenously, ozone intravenously, which we do here at the Center for Healing Neurology. And ozone is actually incredibly antimicrobial too. So it can be used for these things like chronic infection. We're seeing a lot like with autoimmunity. Lyme disease, it's used a lot. And so, so ozone it's really great because it has these anti-inflammatory effects, it has immune modulation effects, and these antimicrobial effects. So it's really cool medicine that is just it comes as a gas. If you ever smell after a lightning storm and you have that specific smell, that's ozone. That's what you're smelling.
And so you're pulling blood out of the body and putting it through the ozonator.
Yeah, usually if you're doing intravenously, you would pull out the blood, you'd add ozone to like normal saline, like a regular IV bag, a fluid IV bag, and then you could put that back in. You can also run it through different UV lights to make it extra antimicrobial, UBI light.
How do we incorporate ozone into like PRP and prolotherapy, the other treatments?
Yeah, so oftentimes, like we talked about, if you have arthritis, let's say in your knee, oftentimes the root cause of that could be that you have chronic wear and tear from some hypermobile ligaments. So I think a really thorough treatment is not just injecting the PRP into the joint space, but also doing prolotherapy to those surrounding ligaments, trying to tighten those up so you're treating the true root cause of the arthritis. And then I always follow it, most of the time I should say, with ozone therapy, because ozone therapy is so great at just stimulating more oxygen oxygen, increasing the tissue, and also switching that inflammatory signaling to more healing rather than degeneration. So I think a really thorough treatment is combining many of these injection therapies all at once. So you can optimize NAD, which is nicotinamide dinucleotide. And so that's just a molecule that allows cellular function to proceed uninhibited. So it promotes oxygen utilization. Mm-hmm. So the net result is that the tissue gets what they need to heal. It needs energy, right? So NAD, optimizing NAD levels is important, which you can do with supplementation. Actually, we're finding the most effective way. You can also do IVs of that as well.
And that is part of our IV therapy program here. So we have that.
So that would be a great adjunct if you're getting ready to do any kind of platelet-rich plasma or stem cell therapy. Nitric oxide is another thing. Nitric oxide, we know that it helps dilate the vessels, so we're increasing blood flow. What a lot of people don't know about nitric oxide, though, is that it actually helps the exchange of oxygen and carbon dioxide be more efficient. So you're really getting the tissues to have more oxygenation, which is the goal. So ozone, NAD, nitric oxide, hyperbaric oxygen chamber.
One thing on nitric oxide, how do you recommend people get that? Are there supplements that you like?
There are, we have them here at the Center for Healing Neurology. There's one company in particular, the Neo 40. I think that's the best kind out there personally, and that's what I recommend. And it's really just a sublingual tablet that you could take once to twice a day. So that one's an easy one to get, actually.
I use it a lot with the Neo 40 with people who have small vessel disease in their brain leading towards dementia, or who have chronically cold hands or feet, or even fungus on their toes, because that's often a lack of oxygenation and circulation in the feet, in the distal extremities. And so Neo 40, people chewing it 1 to 2 times a day will often say that their hands and feet warm up. So
yeah, it's really beneficial. Yeah, when you think about dilating it, and then also just that making that exchange of carbon dioxide and oxygen more efficient.
Have you seen that drops blood pressure at all?
I haven't tracked it enough for blood pressure to be able to answer that. But I do feel like people that take it have healed well after their regenerative medicine. But I don't have a trial going on of people not taking it and taking it. And then hyperbaric oxygen, which we have here at the Center for Healing Neurology. Of course, we know that also will increase oxygenation of the tissues. The other cool thing about hyperbaric oxygen, though, is that it has been shown to increase circulating stem cells in the body. So that's a great adjunct to do. Of course, you do need to do quite a few hyperbaric oxygen sessions to really notice a difference, but it can be, as we know here, used in post-concussive disorder. But I think in regenerative medicine, it has a place as well.
Can you tell us a little bit about what a hyperbaric chamber looks like?
There's different kinds. The one we have here looks like a teepee. So it's not claustrophobic at all, and you just sit in there. There's a lot of ones that, this is a kind of a morbid, I guess, way to say it, but coffin-like, that you would just lay down in. But a lot of people like those because they can just lay down and sleep in them. You can get them at home. I don't know how much they cost, but the type for what we do here for post-concussive and for regenerative medicine need to be at, so ours here are at 1.3 atmospheres. So the lower ones are great for those things that we're treating and don't have to be the higher atmospheres that you would get in like a hospital setting.
All right, so that's oxygenation, and it's something that we kind of zip you up inside of, and you just hang out there for an hour, and you can use your phone or read a book.
Yeah, and the most uncomfortable thing is it would be like flying in an airplane. Some people get like some ear congestion, but for the most part, it's really comfortable.
And if you have a blown eardrum, you cannot go in one.
Yes.
So for CTE, chronic traumatic encephalopathy, that football players are getting from all those concussions, hyperbaric oxygen is one of the interventions that have shown improvement.
Yeah, and like similar to what you were saying with cognitive decline, you're just increasing the oxygenation of the tissue, especially to the small little vessels that go to the brain and to our joints, those types of things. And then another thing we utilize, peptide therapy, and that I think of that mostly of like immune modulation. Mm-hmm. So there's great peptide therapy, which peptides are just these small amino acids that again are signaling, similar to hormones and these cytokines, they're just signaling different responses. And so there's great one for immune modulation, also great ones to help repair cartilage, tendons, ligaments, those connective tissues that we're working on repairing. You can actually do specific cytokine therapy with some transdermal patches, so you can shift those specific cytokines, like I said, the anti-inflammatory ones that we want for healing, for different anti-inflammatory and regenerative processes. So that's another cool new technology we have.
What's in those?
So they have different profiles, like I think the anti-inflammatory ones have interleukin-1 beta antagonist and interleukin-12 and interleukin-10. So yeah, I'd have to look up the exact profile, but they have these specific that are transdermally put on and then they absorb into your skin. So I put patches on people after injections.
Oh, and you use them locally?
Yeah, just locally. Yeah, so again, I can't say enough about foundations of health. If anything, I would tell you to sleep and move and eat before any of these other things, but there are such cool things with ozone and hyperbaric oxygen, NAD, nitric oxide, peptides that are all really cool ways to help us stimulate that healing, to shift that scale that we're talking about. It's all about just shifting the scale to more towards regenerative processes than degenerative processes.
If you are a listener out there who has a joint pain, either from hypermobility, maybe it's got a genetic foundation, but you've developed some pain and you've had this on, or if you've had pain ongoing, or if you've had an injury that's never healed, all of these therapies may be appropriate for you.
Yeah, absolutely. So again, definitely a thorough history, physical exam, and imaging. You kind of want all of it, all the pieces of the puzzle put together, but it is definitely worth consult to see what's appropriate.
Can you tell us just a little bit, just in terms of contrasting, most musculoskeletal injuries, how are they handled currently in the conventional system?
Yeah, so currently, for osteoarthritis, for example, there's bracing, there's weight loss, there's chronic NSAID, which is anti-inflammatories like ibuprofen and Advil. There's steroids, of course, and then there's surgery. So there's limitations to all of those. Of course, like I said, there's a time and place for everything, but, weight loss is pretty hard for people, though, that is important for osteoarthritis and to help with the pain. And chronic NSAID use actually, though, inhibits resolvins, which in our immune system is exactly what they sound like. They resolve injury. So if you're chronically taking ibuprofen, you're chronically inhibiting that healing process for your body. And then, of course, you can get stomach ulcers or kidney and liver damage from too much. And then steroids, too, they inhibit your immune response. So that nothing blocks an immune response like a steroid, because that's what they're good for. We want those when we're having an allergic reaction, that we could die from, and we want our bronchioles to vasodilate. So steroids are very important, but what they do, and they do well, is shut off your immune response. And then they've actually been shown to be chondrotoxic. So that means that the cartilage, they're bad for cartilage. They can actually kill your cartilage, kill your connective tissue, and then if you're taking them long term or systemically, they can mess with your blood sugars and insulin resistance. So there's a lot of downsides to steroids. So we want to use them very appropriately and not as a chronic treatment.
Like you would with a steroid injection.
Yeah, so the problem with, and sometimes a steroid injection, it would depend on your case, could be appropriate. But what happens is you get an injection of a steroid and you halt any healing of that. And so you might get some pain relief temporarily, but it is only temporary. If anyone's had a steroid injection, they know that they're going to get another one in 3 months. And so you're chronically just deteriorating more tissue as you're getting these steroid injections. Mm-hmm. So that's where regenerative medicine is so great, because then you're actually stimulating the tissue to heal, not just shutting off the immune response completely.
All these therapies, though, are not, when we talk about regenerative medicine, our focus today has really been pain and dysfunction. But the world of regenerative medicine also includes a lot of aesthetics. And we do that here because folks are interested in it, so we want to offer what people want and need. So tell us a little bit about the aesthetic world.
Yeah, so platelet-rich plasma can be used for hair restoration. So you think about you're injecting it in around hair follicles to stimulate growth of hair follicles. So that's something it's used for. It's also used, you've heard of the platelet-rich plasma. Vampire facials were very popular.
What is a vampire facial?
It is using platelets. It was a specific doctor patented that word vampire, and that's
really?
Actually when they used more red blood cells, and now they use less red blood cells because they're too inflammatory.
So they would pull red blood cells out like a blood draw and then poke them back into your face?
Yeah, I think they would inject more of the whole blood, where now you use more of the platelet-rich plasma, and you can use a microneedling technique. And so what you're doing is you're placing locally these growth factors on your skin, and you're stimulating an immune response with the microneedling so that you are stimulating collagen production. So as we age, our face loses collagen and we get wrinkly and saggy. And so that's where platelet-rich plasma facials can be beneficial as you're trying to tighten up and stimulate collagen production within the skin.
So we've got clearly a lot of options and a lot of directions where we can do regenerative medicine. Sum up for us kind of how we're thinking about this.
I think it's important to note here that research is mixed with whether there is truly regeneration of tissue or not. You might get an MRI 5 years later, and someone will have significant pain reduction and improved mobility, improved walking scores, but they might not show any more cartilage than they did 5 years ago. So I want to be clear about what are we doing here. What we know we're doing is we know we are decreasing pain. We know we're improving function and quality of life. So that's an important piece to understand. Some people do get regeneration of tissue, but I want to just be clear about that.
It's interesting talking about that because imaging, that's one thing we know about imaging and pain. Pain is such a subjective experience, and there's often a disconnect between what imaging says and what pain is experienced. And that's part of why when you go to the doctor for back pain, it used to be that they imaged everybody's backs, but my understanding is that something like 60% of people in the United States have a reason to have back pain, but not 60% of people have back pain. So that it's not commensurate what we show on imaging and what we experience in our bodies.
Yeah, I see that daily. People will come in with severe pain and nothing on MRI, and some people will be moderate pain and you see their MRI and you think, how are they even walking? So there is definitely a difference between symptom and imaging, which again is why the history and the physical exam should not be overlooked. An adequate physical exam and truly understanding what's going on. Imaging should only be a piece of the puzzle. And again, imaging is very important also though for making sure the injections go where they need to go. So image-guided injections are extremely important, but imaging should always be taken with a caveat as far as treatment and what's going on. It's just one piece of the puzzle.
It sounds like you really take into account what each individual patient's goals are so that you're really personalizing your treatment.
Different people want different things out of injection therapies and how much they want to do and how much they're willing to do. So you just meet that person where they're at and find the best treatment for them.
How many patients come to you saying, I want PRP or I want prolotherapy?
I think it's becoming more and more common, as it becomes more and more mainstream, more people know about it. So I'm getting a lot more people. Definitely, in the midst of COVID, it seems like people now, they're not traveling and they have time to really rest and heal from the injections. So a lot of people are more interested in doing it. So it is a great time for that because there is a level of rest that you need to do after the injections and taking care and not jumping right back into what you're doing. So yeah, my goal is to get the message out there. I believe regenerative medicine is just good medicine, It's not everything. You definitely need to do the work. You need to heal all the other pieces. It's just one piece, but it really truly is good medicine. It's just really stimulating the body's innate ability to heal. So I hope that more people are willing to jump in there because the whole goal for my practice is just to inhibit pain and illness for people because if you can inhibit pain and illness, people can just live a freer life, right?
Yeah.
They're not inhibited by that pain anymore. So imagine what you can do if you're not inhibited by pain.
So this is definitely in this midst of this COVID that does not seem to be going away. We probably have another year. We're recording now in July 2020. So this is a good time to get your body taken care of so that you can hit the ground running if and when our world opens back up for those of us that are closed.
The one nice thing about it seems like a good reset for people and maybe a reset to really sit back and focus on your health and well-being.
Well, thank you, Dr. Squires, so much for being with us today. This is so fun to think about because pain, we talk a lot about pain and a lot about functional pain or dysfunction. We talk a lot about our perception of pain, but really, a lot of times the pain is just in the joint. The tissues are just a mess in there and they need help getting straightened out. And no amount of anti-inflammatory diet sometimes can fix a joint that's just been ground to dust inside.
Yeah, right. Like we talked about, it can just help tip that scale back to where we want it.
All right. Any final thoughts?
I don't think so. I think we summed everything up. Feel free, you can contact anyone here at the Center for Healing Neurology about regenerative medicine. And then I have my clinic at Balanced Medicine, but I see people here, and so you can just contact the clinic. And if you're interested or have more questions, I could talk about it all day long, clearly.
Yeah. And you are open, you're going to be staying open to be seeing patients.
I am seeing patients, of course, taking all extra precautions with COVID. So yes, again, if you are in that space of wanting to heal your body, now could be a good time to do that.
And we have a whole team here who does stem cells, so pretty fun stuff.
Yeah, and what's great about here is, like I said, you have the bone marrow and the fat, but also the stromal vascular fracture with the intravenous approach. So you can really curtail your stem cell and regenerative medicine to what you need.
And you're willing to do like some IV and some joints, so I like that about what we are able to offer here.
Yeah, not many clinics can offer all of those things.
And even all those things in the same visit. So you can get a little here, you could get a little there.
Yeah, and so yes, to be clear, it's not too much. Oftentimes you will do a local injection and also get an IV, so they're going systemically. So that is a unique treatment that is not too much for the body and does really well.
Well, thank you for listening today with Dr. Carley Squires. We've got lots of ways to continue this conversation through Facebook, Instagram, and Twitter. You can get more information from and about us on our website, centerforhealingneurology.com, or even better, come see us in person in our Seattle-based clinic, or find Dr. Squires at her clinic, balancedmedicine.com. Please be sure to share this show with your friends, and we welcome your rating and review wherever you get your podcasts, and feel free to send topic requests to podcast@centerforhealingneurology.com. We love that you've joined us today to discuss how to make our whole world medicine. We rise or fall together and are committed to doing what we can to make as many of us as healthy as possible. And this takes all of us, including you. Thank you for listening, and see you next time.
Partyfish Media acknowledges that it operates and records on indigenous Duwamish and Puget Sound Coast Salish land that is still home to the Duwamish tribe. This land is stolen in violation of the Point Elliott Treaty of 1855. We are committed to uplifting the name of these lands and community members from these nations who reside alongside us. For more information on this land, its people, or ways you can help, visit duwamishtribe.org or realrentduwamish.org.